Welcome back. We are tracking the latest on the vaccine. Halloween may mean something a little bit extra this year for kids 5 to 11 years old. Health experts say that's when younger school-age kids may be eligible to get vaccinated.
Now, in a news release today, Pfizer says studies show the vaccine works in that younger age group. Fox Carolina's Carrie Weimer live for us in Seneca. And Carrie, you spoke with a pediatrician to find out what this means for parents. How soon will offices be able to administer the shot?
Well, Tori, first I have to apologize to any child watching right now because they probably thought we were going to say more candy. That's not the case. It's actually a vaccine, which
it'll be here before we know it. It's okay.
That's right. That's right. They'll get
Apology
candy
accepted.
too. How about that?
Yeah.
That's right. So Pfizer announced this morning this breakthrough in their studies showing that kids ages 5 to 11 given a lower dose of the vaccine actually have the same results as older kids or adults. But of course, that next step in the process is to get that FDA approval.
Currently, only ages 12 and up are approved by the FDA to get the COVID-19 vaccine. But this morning, Pfizer and BioNTech announced studies showing a smaller dose of the COVID vaccine was safe, well tolerated, and showed robust antibody responses in children 5 to 11.
Children make up a large percentage of the percent positive, whereas before they were a small percentage. I've been living, eating, breathing, sleeping this COVID vaccine because if I'm going to recommend it, I'm going to be sure that it's the right thing to do. And I feel that once we get this approval, it's going to be the right thing to do.
Dr. Gully from Blue Ridge Pediatrics says as soon as the approval process is completed, her practice will begin giving the vaccine to kids 5 to 11.
I have no doubt that getting your 12-year-old vaccinated is the right thing to do. And as soon as we get the studies back and the FDA approves the safety in the 5 to 11-year-olds, I'm going to recommend the same thing for those children.
She says the natural COVID infection itself does not provide prolonged immunity.
The vaccine actually provides longer immunity than a natural infection. And so I keep telling people, just because you had COVID last month, you still got to get vaccinated.
Some parents we talked to say they're worried about possible long-term side effects from the vaccine for their kids.
A vaccine, by definition, cannot have long-term side effects, only short-term. So because the way that the vaccine works, it delivers an antigen, the body makes a antibody to it, and then that delivery mechanism is gone from the body. So it doesn't cause long-term side effects.
But she says that isn't the case with having the coronavirus.
We definitely know there's going to be long-term side effects from getting COVID. It affects most major organs in the body and causes inflammation. So when these kids start getting their second and third COVID case, what are the long-term repercussions of that?
Now, Pfizer says they plan to have results from studies for kids under 5 years of age by the end of the year. Tori, Michelle?
All right, Carrie, thanks for that report. And of course, we'll continue to stay up to date on all those changes for you. We'll bring you the latest right here when we're on air and also through our Fox Carolina News app.